Hi, everybody. My name is Keely Spring. I'm a licensed marriage and family therapist in the state of California. And today I have with me Natalie. Natalie and I were recently introduced, so I will be just learning more about her practice as well with everybody here. And without further ado, I'll turn it over to you, Natalie, to maybe introduce yourself, your niche, kind of the populations you work with, and we'll kind of take it from there.
Awesome. Well, once again, thank you so much for this opportunity. So my name is Dr. Natalye Pearson. I'm a licensed clinical psychologist here in the state of California. um, and I work with folks, predominantly folks of color, around healing wounds of racial trauma and all the various ways that it impacts people.
Mhm.
And so I work with adults. But I also have a background in my primary specialty is like trauma, and then my secondary specialty would be working with folks in addiction medicine and recovery. So I say that because all of that informs my work. Um, yeah, so I work with folks individually, and then I am in the process of creating a group with another clinician um, that will hope, and it's an online group that will hopefully start working with folks who've experienced racism in the workplace. And so,
Interesting.
yes, yeah, it's a big thing.
For sure. Yeah.
Oh,
Um,
and I'm sorry, and I will say that I've been seeing clients since 2004.
oh,
So
been a minute.
yeah, it's been a minute. Yeah, I mean, they started us early in graduate school, so
Wow.
yeah. Mhm.
hmm and Natalie, could you just speak to you like I have a MFT, but you have a PsyD. Could you
Mhm.
explain kind of, what the difference is in the clinical kind of training that you receive and kind of what that looks like a little bit?
Absolutely. So I mean, I'll let you say what the training is for MFT because I don't know.
Sure.
But so for a PsyD, you have a doctorate in clinical psychology. And there's folks who are psychologists that have a PhD, which is a doctorate in philosophy with an emphasis in psychology. One of them is more research based, that's a PhD, and one of them is more practice based, that's a PsyD. And both of us have the ability to see clients. So my training is that I went to school for about 4 years. And everything is specifically for psychology and the various different, areas of psychology. I start doing practicum. Some schools have you start doing practicum your first year. Mine was my second year. So I think there's differences in also like clinical like hours and so forth. So I would say I've had prior to getting licensed, I had about, and I really was just talking about this the other day with one of my friends about 8 practicum experiences. So with that, or years of practicum, which means years of training, right? So I did like 3 before I graduated. Then I had my pre-doctoral internship, and then I go on and do a postdoctoral fellowship. Um, and we have different requirements that are similar, but different requirements for licensure. So I take a national test called the EPPP. Can't even tell you what that stands for right now. Sorry. And then I have a California psychology test that tests me on ethics and legal issues. I have the ability to do full battery psych assessments. Um, and I'm trying to think what else is the differences. I think really it's like the length, right? And it's really more invasive. I guess invasive is the wrong word.
Comprehensive.
Comprehensive. There you go. Comprehensive. It was invasive to my life, but comprehensive. And yeah, off the top of my head, I'm sure there's more I'll think of as we go along, but I'm also thinking about time. So,
Yes, of course.
mhm.
Appreciate it.
Mhm.
Appreciate it too, because yeah, there are different requirements, and I think one of the things I see with PsyD is kind of what you discussed, which is kind of that psychological assessment. I think PsyDs have a much better understanding of the psychological assessments just because you're trained in that. We get the basic trainings, but not the kind of more comprehensive look at that.
Yes. yes. In depth is what I meant. Yeah, more in depth instead of invasive. You can see my mind is all over the place. But yeah, I mean, I wrote a dissertation. Yeah, there's a research component for us too. So absolutely.
For
Mm-hmm.
sure.
Mm-hmm.
Well, so that kind of leads me to my next question. We're gonna circle back to the work that you do clinically, but before we get there, could you describe why you, or maybe not describe, but share with us the journey that you took to becoming this path? Like, how did you decide that you wanted to go this route?
Yeah. Well, when I was about 12, my sister started um, demonstrating, like having symptoms of her own mental illness, which was schizoaffective disorder. So it's kind of like, on the psychotic spectrum. And I, and it was also at a time where her diagnosis was linked to something more biological. And so I thought at that age, I wanted to be a brain surgeon. I mentioned that because like I'm still in people's heads, right? Right. Um, and then I think that sparked my interest in mental health, and just how we can have different realities, right? Like she was very present and here, but her in her mind something totally different was happening. And so then I took in high school my first psychology class, and I just fell in love with it. And I was like, oh my gosh, these symptoms and this and that, like this is, my sister. And so that just kind of set me on my path. I went to undergrad. I thought I was going to major in psychology. I did not. I majored in sociology with a minor in ethnic studies, which I think sociology is kind of like a really great nexus of the psychology of society, on a macro level. So still analyzing human behavior, but more on a macro level. Um, I thought I was going to go to Temple to get my master's in social work, and I got waitlisted, and then I got accepted to a doctoral program. So it's kind of like by chance that I got my doctorate, but I I um, it's really interesting because the school I went to, I thought um, it was this is so funny. I'm stuttering over my words because I'm like, do I really want to say this? It was kind of like a a compromise with me and my best friend. We were both applying at the same time, and he said, I'm going to apply to doctoral programs. And I was like, I could never do that.
Mhm.
um, I just knew that I wanted to work with people.
Mhm.
I knew that I wanted to get and specifically I knew that I wanted to work with Black folks around healing internalized depression because I was struggling with that. And
Mhm.
I thought I needed like the tools to do that, which is true. I did. And so that's what led me to where I am now, like in terms of my specialty, working with people, and really healing their internalized messages
Mhm.
that we get from society. Um, uh, yeah, so that's kind of like a really quick and dirty way, of how I got here.
It's a beautiful segue though to let's discuss your niche and where my first question would be is what are kind of some of the symptoms or things that somebody who's experiencing that type of trauma might exhibit or need support around?
Wow. Wow. When I think about racial trauma, I think of it as like it's like kind of three different traumas in one. It's acute trauma, which is like, something that's happening in the moment or that's happened very recently. It's chronic trauma, something that has happened in the past or just continuing to happen like in this like lifetime. And then it's intergenerational trauma, which is like trauma that's passed down through behaviors and so forth from other generations. So I think that being said, it's very complex and it can look like a myriad of things. It could look like imposter syndrome. It could look like feeling uncomfortable, like walking into stores or going certain places. It could look like doubting yourself in the workplace or doubting your intelligence or and really it could look like in your relationships too. How do you relate to other Black folks? How do you relate to other folks outside of your ethnicity? Like, how do you relate to yourself?
Mhm.
Uh, I think it also, it could look like really struggling with a sense of self and acceptance and a sense of belonging, right? Because there's so much that has gone into telling you that you're not intelligent, well, you're not human,
Uh-huh.
because there's that whole three-fifths of a man in the Constitution. You're not, and you're angry, or you're not allowed to have the full spectrum of your emotions, and it becomes something that we think is of our own. And so I think it starts to really like erode, like I said, our sense of self. And people don't really get that what they're experiencing is because of this outside idea, you
Mhm.
know. But when we start talking about it, and really looking at like, where did you get this message from? It's usually connected to some form of racism or internalized depression,
Mhm.
you know. So I hope that answers your question, because it really does. People come to me, and it's like they come to me for one thing, and then we start peeling back the layers, and it's like, oh my God, I had no idea. Or I didn't realize that when I was doing that. I didn't realize that when I was walking into this meeting and I was like fixing my face, because I want to make sure that, like, I'm seen in a certain way, that's a form of like internalized depression. So
Yeah.
yeah.
Yeah, it reminds me of a book I read a while back, Whistling Vivaldi. Have you heard of this? But basically, this gentleman, he would whistle Vivaldi as he walked down the street so people would know he was not a threat. And it was kind of his experience of it. I think that's kind of what you're speaking to.
Absolutely, Keely. I mean, we even change our voices,
Uh-huh.
like, it's got to be a certain way. I mean, this is my actual voice, but like, yeah, there's so much to make other folks feel comfortable because we're aware. So there's also like this um observing ego happening too. It's really interesting. And so, and I think especially with this administration and what's been happening, I don't know, I mean, forever, but with this particular administration, um, I think that racial trauma is being felt in so many different ways, but it's really pervasive. Like, it's when you turn on the TV and you see, like, things are happening to other people, or getting snatched up, or separated from their families, and you notice that they have the same, that they're, an ethnic minority, they're black and brown, and you're wondering like, oh my gosh, when am I next? That sets in all sorts of like, symptoms. And they are very comparable to PTSD and the DSM, the hypervigilance, the, intrusive, memories, the, how it affects your sleep. And I can go on and on and on and on.
Hmm. Yeah.
Mhm.
So, what would be some modalities that are kind of your favorite or your go-tos for, helping people heal from this type of trauma?
Yeah. Well, I like to say I'm an integrative, psychologist. Um, so funny because when I was in graduate school, I was like, they were trying to force me to decide what was going to be my theoretical orientation. And I was like, I don't really know. I don't, like I can't pick one. And this one professor was like, well, you really need to know because blah, 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 blah. You really need to know because I think for her, it was like, you need to have like a sense of mastery around one or the other. But then that's not meeting your clients where they're at. So that's why I say I'm an integrative, psychologist, because I do want to meet my clients where they're at, and not force them into what I believe is the best theory orientation. So that being said, I like to formulate psychodynamically. I like to know like what are your past experiences that are informing like, how you're moving through the world today, right? Your childhood experiences. When did you first learn, these things? Definitely relational therapy, definitely narrative, which is like again kind of like changing the narrative, exploring like what was internalized, what, you know, like really like the stories that you tell yourself, right? So being able to externalize the problem and then explore more about where it came from and change the narrative, right? Which kind of goes along with acceptance and commitment therapy, which is another favorite one of mine. Like really accepting that you have these thoughts and these feelings. There's a certain way that we can, again, like here's another PTSD symptom, disassociate from what's happening
Yeah.
by dismissing our experience completely, dismissing our feelings. We have also been told that our feelings don't matter or our thoughts don't, or you're not feeling that. That's not happening. Racism is not happening. I didn't say that. That wasn't racist. Your feelings are not hurt, you know. And so I think accepting that you're having these feelings, accepting that you're having this experience, accepting that you're having these thoughts, accepting that it's impacting you in these ways, but then also committing to like, well, one, we like, then look at like your values and how to like move towards what you want, right? The life that you want. Um, of course, DBT, distress tolerance, and all of that, skills building and with CBT. So it's motivational interviewing. It's like,
All the things.
all the things. And I like to say that I'm a therapy junkie because I think it's all grease for the grind, you
Yeah.
know. It's
Yeah.
all to help you. And so I'm kind of pulling from a couple of different things. Yeah.
Mhm. Yeah, I totally resonate with that. I feel like we have to meet people where they're at. And so you have to have a big toolbox to pull from with all these different modalities. And, not one person is going to need the same thing.
Absolutely. Yeah. Yeah. Mm-hmm.
That said, what would a typical session look like for you? Is it more organic, kind of following the person where they are, or do you come in there with kind of a, agenda or, some sort of, like EMDR is always like the 12 steps that you get through and that kind of stuff.
Mm-hmm. I definitely think that it's more organic for me, but it's also like what my clients are bringing in. Of course, we have like a little bit of structure, like checking in, how are things happening, like what's going on for you this week, and like if I'm working with somebody who's like in recovery, like of course I'm going to ask like, what are your cravings? Have you been to meetings? What's happening, right? So I think there's in that way I do like a little check in, but then it's like this is what I mean about like the interpersonal, like, dynamic. It's like what is being brought forth, right?
Mhm.
Um, Sometimes that doesn't work with some clients. Like I had one client who was like, well, you're the professional. And I'm like, I am the professional, but I, I don't know what's in your head. I don't know what's like happening for you. So there's a little bit of that. I'm also following, as we say, our chief complaint, like what did they come in seeking help for? So that is guiding our sessions, but that varies different, from week to week, how your chief complaint is manifesting in your life like today. So yeah, there's a little bit of an agenda with check-in, and then also like I give homework sometimes depending on what's happening. um yeah, but it's kind of organic.
Uh-huh.
Mm-hmm.
Yeah.
Yeah.
Yeah. I always love the people that are like, well, you're the professional, you tell me. And I'm like, I can't mind read, but
Yeah.
I actually don't wish I could, but
Yeah, and also like in that, like, you're the professional, I'm here for you to tell me what to do, and it's like, no, 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 that's not therapy, that's advice.
yeah.
you know what we're doing is exploring like what is happening for you, what is like behind all of this, why. I mean, because like I think like what I've kind of said before, if you could do it then you would just do it. If you could stop drinking you'd stop drinking. Like if you just could like, oh, okay, this is racism and this is how I do it. No, it's like we need to explore like what are the emotional obstacles, what are the core beliefs that aren't true for you. I think a lot of my work is reconnecting people to the truth of who they are.
Huh.
I think that's a really good thing about like racial trauma or any trauma. It separates you from the truth of who you are. So I really want to like bring that back. But I can't tell you who you are.
Uh-huh.
We're on this journey together. So discovering that together. And that really makes it exciting for me, you
Hmm.
know.
Hmm. Yeah. No two sessions are the same because the person is different and has their own unique.
Absolutely. And I mean, and even in like I mean, you know this, like depression looks different for this person than it does for that person. It's the same set of symptoms, but you know, it just looks different for each person because we're humans
Hmm.
and we're diverse. And yeah, we're having individual experiences. So yeah.
For sure.
Hmm.
So still in the clinical realm, but
Yes.
switching a little bit here. What do you like about being a clinician?
Right. 'Cause I was just talking about that. Like, what do I, oh man, like I said, I'm a therapy junkie. I love therapy. I love being in therapy. I like doing therapy. I like individual therapy. I like group therapy. I think what I like about it is the exploration of self. The, I mean, going back to like what inspired me, I was fascinated that like you're sitting with me, my sister's sitting with me, but she's having a whole nother reality. And that's in your mind. So the mind is so powerful. And I really do enjoy like seeing the various different ways our mind works. And also I love seeing how people heal. Oh my God, it's so inspiring to me. Um, like I said, my first specialty is trauma work. That takes a while to see a lot of change. It's very intense, right? And there's a lot of pain. But what I loved about recovery is that the change is quick.
Mhm.
Like if you are, if we're doing what we're, we're following a program and all these things, the change is quick. And I am so inspired by people's willingness to do things differently, willingness to like, okay, I'm scared, but I'm gonna do it anyway. Like, and what they learn about themselves from their healing, it's incredibly motivating. Um, it's never a dull moment. uh, our work is like, I never know what's gonna happen each day. And I like that. I kind of miss working in a clinic because I loved like the waiting room. I'd walk through the waiting room and there's always like something like, ooh, what's going on? Yeah, you know, it's just different every day. Um, yeah, I just love seeing people go for theirs, go for their healing. When
Mhm.
you show up with me, that means like we're invested in some way, shape, or form.
Mhm.
And yeah, I just love being along for the journey with people.
Yeah, yeah. Love that answer. And it's a wonderful segue to the next question, which is, are there things that still surprise you about therapy?
All the time. All the time. I think like a little bit of like what I said, like just like the rain, like there's a lot right now about diversity and equity and inclusion and yes, but I'm saying like the diversity of like human beings in
Mhm.
general, our experiences. I, yeah, that alone, like I said, anxiety looks different for this person and that person. Trauma looks different from this person and that person. We do have a set of symptoms, but and even that somebody could be having the same symptom, but it looks different. Um, so for that, I am always like surprised. I'm surprised by people's their courage. It's scary. Coming to therapy is scary. Being with sadness or guilt or shame or looking at um, mm, your internalized messages and core wounds, like that you got from awful experiences, that takes so much courage. And so I'm always surprised that people are like willing to do this. I'm grateful that they are too. But I can't say enough about just like the healing process, or it's just, yeah,
Mhm. Yeah,
I like
it
it.
is quite the honor to be able to be on that journey with people and really kind of just help them seek that healing and really kind of just be a witness to that.
Yeah. And, and, and that this is like a very unique relationship. It's unlike anything else. And so the intimacy, the vulnerability, um, yeah, those are all things that surprise me, our
Mhm.
willingness to trust,
Yeah,
as well.
for sure. Is there anything that you wish people knew or understood about therapy that either comes up in personal life or professionally?
Oh, I hate that there's such a stigma around therapy. You
Mhm.
know, I wish people knew that therapy doesn't mean that you're quote unquote crazy, that we have been doing this for a while. Uh, it might have looked different generationally. And this is what I mean when I talk with, you know, there's a lot of stigma in the Black community diasporically around seeking treatment.
Mhm.
So when people come to see me, I have clients that are, from like Nigeria or the Caribbean, or
Sure.
like there's a lot of like kind of dispelling those myths.
Mhm.
And so some of them is like you're not crazy. This ain't white people shit. Like we have been doing this. We would go to an elder, or we would go to someone in, the church,
Mhm.
and so this is more so um for you, this is a luxury,
Mhm.
this is a privilege,
Mhm.
especially because we're told that we don't deserve the full range of our emotions or to be able to feel these things. And
Yeah.
so I wish I could tell people that we are healing for generations, and how much it would be that somebody in your line wanted this,
Yeah.
your ancestral line,
Mhm.
wish that they had someone to
Yeah.
hold their experience, or
Mhm.
that they had an hour out of the week just devoted for them, you know. So I wish people knew that this is a privilege, and that this is, I am devoted to you for this hour. I'm focused solely on you. I'm gonna challenge you a bit. We're gonna have some fun. It's
Fair.
not gonna be all me just like praising you. Like, we're here to work. And so that means I'll be with you, like, even when it gets really difficult.
Mhm. Yeah. Yeah.
Yeah.
Love that answer. Thank you. So final question in this kind of more clinical space, and then we're gonna get to know you a little bit better. Is there a tool that we could share with the audience that you think could be impactful or useful that people could kind of readily access?
Yeah. I love breath work.
Okay.
I love breath work. I think a lot, in order for us to do the work, sometimes we have to learn how to tolerate the distress, kind of like bring it down a notch. And people think breath work is kind of hokey and things like that. And I'm just talking about diaphragmatic breathing. But it is a way to get present centered, and we breathe 22,000 times a day. It's our life sustaining thread. And we never think about it. Like, if you're not breathing, you're kind of like you're dead.
Yeah.
So I always like, it's a way to kind of like get back to like this thing,
Hmm.
this constant in and out, that's happening. It's to get present centered. I also do a lot of visuals with it. Like, I'm taking in what I need, I name what I need, I'm breathing out what I'm letting go of. There's so much that I get just from thinking about the process of breathing.
Hmm.
So diaphragmatic breathing, and then that goes into meditation and other things. And then my other favorite tool is 5 4 3 2 1 grounding. You
Uh-huh.
know, um, we are dysregulated all the time.
That's fair.
I need to ground. I need to ground when I'm in traffic.
Yes. Don't we all?
So I tell people, like, nobody knows you're doing these things.
Yeah.
You're in a meeting and it's crazy, anxious, and like, anxiety is up. Nobody knows you're doing these things. You just take a deep breath.
Hmm. Hmm. Could you explain the 5 4 3 2 1? I obviously know what you're talking about, but what those things are.
Right. Right. It's a grounding tool in which you're kind of really bringing in, like, again, like present centeredness. But how do we do that in various different ways? I want to bring in your 5 different senses. And
Mhm.
you can do this in any way that you'd like to, but I like to think of it like 5 things you see, four things that you hear, three things that you feel like a physical sensation, not emotional, but a physical sensation. Um, I said here, two things that,
Smell?
what?
Smell?
Yes, smell. Thank you. And one thing like you taste in your mouth. Because sometimes when we are feeling dysregulated or something's happening for us emotionally, it might change, like you might
Yeah.
have a metallic taste or something, you
Mhm.
know?
Mhm.
So yeah, and even like that, like it's not just like what I see, like, oh, I see an orange, dress on this like painting behind you.
Oh,
Oh, not behind you, but I meant like behind my monitor.
oh, okay.
Um,
Like,
I'm thinking about like what do you see texture wise? What do you see shape wise? Like really bringing your senses on board.
hmm. Yeah, I love that one. I use that one often with people because it really is aimed at getting people out of their head and back into their body, into the kind of felt sense of where they're at in the moment.
Yes, yes. 3, 2, 1, 2. Sometimes we're too dysregulated. So like I can't think of five things. Okay. Three things you hear, three things you see, two things you hear, one thing you feel, sensation. Like,
Yeah,
yeah.
yeah,
So
yeah. Love it.
mhm.
Okay. Thank you, Natalie, for answering those. Are you ready to take what I'm now calling my being seen questionnaire for clinicians?
So okay.
I promise it's not painful.
Okay.
So the first question is, what is something that's making you happy right now?
That's a really good question. Just because there's a lot happening in the world and I really do have to like think about what's making me happy. This could be something that I would say all the time, but my son makes me really happy. Like, he's just starting high school. And so like seeing life through his eyes is makes me happy. Like ever since he was born, like uh just going through life a second time, right? Through his and watching him have these experiences, watching him also learn to like trust himself and um like, wow, I didn't think I could do that, but I did that, So my son and then my dog Louie. Louie makes me happy. My little Chihuahua. He's funny.
Nice. Okay, what is your favorite app?
App?
Yeah,
Ugh.
we're both in the Bay Area. Tech Central.
I know I'm so embarrassed, but it's Instagram.
It's
I'm
okay.
addicted. I'm addicted. I need not to be addicted. Uh, I'm on it all the time. I love reels.
Uh-huh.
Yeah. So, and what I like about reels is like, um, sometimes they're informational.
Mhm.
Please do your research after,
Sure.
everything is true. But also like, sometimes it's just an escape, you
Mhm.
know. Uh, of course, I love dog videos, and of
Uh,
course, I love baby videos, and I'm like, oh,
yeah.
my dog is so smart, or baby, So those things have helped me get through difficult times.
Mhm. Yeah.
Mhm.
Yeah, I don't do Instagram, but I do on YouTube. I will get sucked into like dog videos or the rescue ones, and I'm just like, for hours. I'm like, where did the time go?
I'm
Yeah.
bawling. I'm like,
Yeah.
oh
Yeah.
my God, they train them so well, they
For,
are us.
for sure. Okay, really easy one. Beach or mountains?
Oh my God, beach. I mean, I love the earth. Yes, I love going hiking and all that, but no, no, you can't take me away from a beach. I love it. There's something about the sea, and let me be even more specific, the Caribbean Sea. It's
Uh,
just, it's amazing. I
uh,
think the Pacific is rough. I get beat up out there, okay?
yeah. Yeah, well, because I mean, you're getting right. Whereas the Caribbean Sea, I've been to it before, right? There's so calmer water. Well, minus hurricane season or whatever, but there's calmer waters and that crystal blue kind of aquamarine color.
Mhm. Yeah, when I meditate and they're like, and I'm doing a visual of like very woo-woo, okay? Very California, but I don't care. Like pulling up energy from the earth, like to kind of like heal things in my body. I imagine the perfect blue and that golden sand, like
Mm.
that swirling together.
Uh-huh.
Beach all day.
Easy answer. Okay, a little bit more tougher one. What is one thing that movies never get right?
Oh God, they never get black women right.
Okay.
Mm-mm. They never get black women right. It it's always a caricature. I mean, obviously, because like it's a, but it's like sometimes overdone. Like I'm yet to see like someone like me, like dark skin with like dreadlocks and or like friends, like everyday situations. It's always just like so cliche, you know. So yeah, they never get that right.
Yeah, that's fair.
Mhm.
Okay, best way to relax.
Hmm. Oh, okay. So I have two answers. Like I love to dance, so that does help me to relax.
You
Just
do that with other people or just kind of by yourself?
with other people. Yeah, 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 yeah. Like I just like the movement. There's a always a moment where like you kind of lose yourself with the music, and so that helps me to relax. I feel like when I haven't been out, yes, I do stay in the streets. Okay, I'm at somebody's club. I'm always dancing to soca music, and but there's a moment where I kind of like lose myself in the music, and I think because I am so focused on people, you know,
Sure, sure.
it's good to just like what I call free up. That feels relaxing to me. Like afterwards, I'm like, oh man, I needed that.
Mhm,
Mhm.
mhm.
And then of course
Uh-huh.
meditation, just it's like um different sides of the same coin, right? Sometimes I need like to be activated, and sometimes I need that quiet time to just be with things.
Kind of
Mm-hmm.
center.
Mm-hmm.
Like getting that energy out versus centering that energy with it.
Yeah. Yes, absolutely. Sometimes I need to go within, and so that helps me to kind of like um remind myself of like that relaxing feeling, when
Yeah,
your mind is at peace. Mhm.
for sure.
Mhm.
Okay, dream trip location. Anywhere you want to
Oh my God.
go?
Yes. The Seychelles. I love
Oh, yeah.
the Seychelles islands. Recently I've had like a couple of friends go, and it just looks otherworldly. It's so beautiful,
Yeah.
and there's like some really beautiful formations on the beach, like with the rocks and
Mm,
the sand. It looks like a big old sandy rock. That's not a good description, but like it, it looks beautiful. Let's just do that.
yeah. Yeah, I've seen some quite beautiful photos of the Seychelles. So
Yeah.
yeah.
Yeah. See, an island, the ocean.
Yeah. Beach everywhere.
Yes.
Yeah.
Mhm.
Okay, what advice would you give your younger self?
Travel, girl. Travel now. I,
Uh-huh.
I think I wasted a lot of time. Like if I could do it all over again, I would have like really like used college to study abroad, or in high school. I didn't do those things. I was a little too scared.
Oh,
So like one, I would say like um Natalie, travel like in college. That's the only time that you're going to be able to go someplace for like 4 months,
wow.
and really get like the without it being like crazy expensive, right?
Mhm.
Um, and then like don't be afraid. Or if you are afraid, do it anyways. Because we've benefited a lot from being afraid and continuing to do things.
Yeah.
Um, I wish I would have started doing that a lot earlier, or in some other things too, like moving. And I'm very much like a Bay Area native. I have not moved. And sometimes I see people who moved across the country. I'm like, wow, I wish I could do that.
Uh-huh.
And so, yeah. Mhm.
Yeah.
Travel and moving, all those things. Mhm.
Yeah. I think our society is very fear-based in a lot of ways, right? We have the messaging we get, those kinds of things. So, yeah.
Yes, absolutely. Mhm.
Okay. Out of the four seasons, which is your favorite?
Fall.
Oh, okay. So where we're headed now.
Great. I got answers right away. Yeah, it's party, party, party. But I mean, it starts with my birthday in September, September 4th.
Oh, happy early
Uh,
birthday.
thank you. And anyone knows me knows that I'm always talking about my birthday. So yeah. And then there's Halloween, and then there's Thanksgiving, which I call Gratitude Day. And then there's, Christmas and New Year's. Like there's always something, you know, to do to
Celebrate.
look forward to. And the the trees, even though we don't have that much here in Oakland, there are certain streets I can go down and see the trees, the foliage.
Yeah. I've never been to there's I think it's like Maine or there's somewhere on the East Coast that apparently like the foliage is just unreal.
I hear it is. Yeah, yeah. Yeah, I think anywhere on the East Coast. We just don't have it that. Yeah. Mhm.
Okay, three more questions here.
Mm.
What would be the worst superhero power to have?
Oh wow. Worst superhero power. Um, let me think of some. Like, what are there? There's like, what is it? Oh God, there was something where this guy, I think it was like, oh God, I can't remember. Um,
Was it like a Marvel movie or was it?
Marvel, Birds of Prey or something like that. Or
Oh, I don't think I saw that one, but I know what you're talking about.
I, I don't know what the girl's name is. Like,
Is it Harlequin? Is that the
Quinn, yes, it's one of the Harley Quinn movies. And there was a guy that like I think this is like that movie where he like was a dot man. Like he had this like weird um like condition because they like gave him like some radioactive thing that made him like have these dots that grow out of his face and his whole
oh,
body,
oh,
and he has to expel them,
oh,
and
okay.
they blow things up.
Oh, that sounds horrible.
It sounds because he looks normal. And then all of a sudden, as the movie would go, time and time would go, like, what's that in your face? And they would get like bigger and bigger and all these, and they were different colors. It was weird.
Yeah. Yeah.
That's a bad one.
Yeah.
Yeah.
That sounds pretty horrible for sure.
If
All right.
anybody like remembers the name of that movie or whatever, yeah.
I'll definitely look it up after this. I definitely didn't see that kind of series of movies, so I'm not as familiar, but okay. What is an animal that resonates for you?
Mm. There's so many. Um, well, let me just clarify a question. Resonates in what way?
Just the one that you're kind of drawn to that you think, is inspiring, powerful, has meaning for you in your life.
Hmm. Okay, so I love Mudang because like she's so cute, the baby hippo. So
Uh-huh,
there's that.
uh-huh.
But really, that's just because they're cute. But I like I guess the plural would be octopi. Like
Uh-huh.
I like
Yeah, as well.
octopus. They're quite amazing. Like to be able to change color like completely and texture, you know. And then to be able to like fit into like like there's no bones. I
No,
don't.
it's just like their beak, and as long as their beak can get through it, they can fit.
Right. Yeah, I'm fascinated, And I also don't want people eating them. Like, why are we eating them? But
Yeah,
anyway, um,
I don't
they
eat
are
for that
right,
reason.
right. I mean, to each their own, but they're so amazing, like yeah, I'm always like whenever I watch like a lot of National Geographic. I'm always fascinated by like that they can completely look like whatever the hell they want to in like that.
Yeah,
That that's crazy.
yeah,
Mhm.
yeah. A few years back, I read a book called The Soul of an Octopus, which is what kind of turned me off of like I never was a big octopus or octopi eater, but But it's really fascinating. It's about the Boston, the Marine, whatever place, and it's about like their octopus there and all the things they learned about like how intelligent this animal is and how it could sense if somebody smokes cigarettes or, just by its, little suckers and all that kind of stuff. Fascinating.
Absolutely. And there's so much we don't know too, just about like creatures in the ocean. Like
Yes.
that might be another reason why I like the ocean too. It's vast,
Yeah. Yeah.
Yeah. So
Yeah. We know more about the universe than we know about our own ocean, which is always so overwhelming to me that we don't know as much about our what's here.
Chu, I think you like the ocean too.
I do. This is true. Somewhat fascinated. Okay, final question here. When you look back at your life, what do you hope you'll be able to say?
I really value my relationships. My friendships are everything. My familial relationships are everything. And I think when I look back on my life, I hope that I can say that I was a good friend, um, that I caused no harm. I'm sure I probably did, but I mean, like, like real talk, that I respected my friendships, the connection, it's really important to me. So, yeah, I hope that it sounds like very light, like that I was a good friend, but I mean that. Like,
Yeah.
I don't want to be thought of like as a shitty person, or that I was like backstabbing and talking shit behind people's back or whatever it is. But yeah, that when people think of me, that they think like, wow, Natalye was a good friend.
Mhm.
Mhm.
Love it. Well, thank you, Natalie. You are officially seen.
Oh, thank you
Appreciate
so much.
I appreciate you taking the time to speak with me. For anybody watching or listening, I will include your information below. But that said, is there anything that we didn't discuss that you feel like you want to make sure that we let the audience know before we hop off here?
Mhm. Man, well, I was listening to another podcast, um, and I think her name is Jessica Lanyadoo, and she was saying like, if you are feeling burnt out right now from all the atrocities and the genocides and the things and da da da, da, like, yeah, you're supposed to, because it's like you're human, and this is like fucked up, and so I hope people like realize uh, that it's okay to feel bad, and not to kind of like shove it down. I'm a good shove it down person. Yes, I know I'm a therapist, but we still got our faults, right? And but that, like it's important, that if you're feeling, yeah, this is something to feel something about.
Mhm. Yeah.
Yeah.
Yeah,
So
it's welcome.
yeah,
It
yeah.
may not feel welcomed, but it is welcomed because it's reality.
It's reality, and I guess that's where my mind is at right now, right? Like, it's rough right now. And if you're like feeling um sad about that or hurt about it or frustrated about it, yeah, you're not crazy,
Yeah.
you know.
Yeah.
Yeah.
All right. Well, thank you again, Natalie, and appreciate your time.
Thank you so much. Thank you so much.